Hello, everyone, and a very warm welcome. It's so lovely to have you join us today for our webinar on hearing and vision changes, how to stay connected and engaged. Before we begin, I'd like to acknowledge the traditional custodians of the land on which we're meeting today and pay my respects to elders past and present. I extend that respect to any Aboriginal and Torres Strait Islander people joining us today. My name is Beck. I'm a business manager at Catholic Healthcare, and today is all about helping you stay connected, confident, and engaged in everyday life so you can continue enjoying the things that matter most to you in the place that you love. Thank you so much for joining us today. We're really pleased you could be here for this conversation because today we're talking about something that affects many people as we get older. Changes in hearing and vision, and how these changes can impact not just how we see and hear, but also how we communicate, move around safely, and stay connected with others. This will be a practical and supportive session. We'll hear from members of our team who work closely with people in the community every day, sharing simple, helpful strategies and real supports that can make a meaningful difference. If you do have any questions as we go, please feel free to pop them into the Q&A section. We'll keep an eye on those throughout the session, and we'll also pause towards the end to go through as many as we can. So please don't feel like you need to hold on to your question. You're very welcome to add it in at any time. Changes in hearing and vision are very common as we get older. Often these changes happen slowly over time, sometimes so gradually that people don't notice them at first. It might be things like turning the TV up a little louder, asking people to repeat themselves, finding it harder to see clearly in low light, or feeling a little less confident out and about. On their own, these changes can seem quite small, but over time they can start to affect confidence, communication, safety, and connection with others. Today is really about recognising those early changes, understanding what supports are available, and knowing that there are practical things that can help. I'm joined today by a few colleagues who bring a range of expertise and perspectives. Michelle Excel, our registered nurse, who will talk through some of the common changes in hearing and vision and what to look out for. Joy Howe, our occupational therapist, who will show practical ways to support safety, independence, and confidence at home and in the community. And Sophie Mills, our care partner, who works closely with clients day to day and will share what support can look like in real life. To start us off, I'd like to bring in our registered nurse, Michelle. We might begin with hearing and take a little time to really understand what changes can happen as we get older. So to begin, Michelle, from your experience, can you help us understand how hearing tends to change over time and what some of the early signs might be that people don't always recognise straight away?
Thank you, Beck, and hello, everyone. It's really lovely to be here with you today. As Beck mentioned, hearing changes are often quite subtle in the early stages. Because of that, they can sometimes be easy to miss at first. Often it's not the person themselves who notices straight away. It might be a family member or friend who picks up on it first. One of the most common things we see is age-related hearing loss, which usually affects how clearly we hear sounds, particularly higher-pitched sounds. People often notice this most in conversations, especially when there's background noise. So some of the early signs we commonly hear about are asking people to repeat themselves more often, turning the TV or radio up louder than usual, finding it hard to follow conversations, particularly in groups, or feeling like people are mumbling. Sometimes people also notice they feel more tired after social situations because they're concentrating that little bit harder to hear.
So what is it that actually changes as we age that means we don't hear as well as we used to?
If we look at the ear, it's made up of three main components: the outer ear, the middle ear, and the inner ear. The inner ear is where we have very small hair cells that help convert sound into signals the brain understands. As we age, the main changes usually happen here in the inner ear, where those hair cells can become damaged or less effective. And unfortunately, they don't regenerate. That's why hearing changes often become more noticeable over time. Sometimes we describe it a bit like the ear becoming less sensitive to sound, but it's also really important to say that not all hearing changes are simply due to aging. Things like wax buildup, infections, certain medications, long-term exposure to loud noise, some health conditions such as diabetes or high blood pressure, and even family history can also play a role. The good thing is that some of these contributing factors can often be treated or managed. Over time, hearing changes can begin affecting communication. And what we sometimes see is that people begin withdrawing a little from social situations because keeping up with conversations becomes more difficult or very tiring. That's why it's really important to have your hearing checked if you notice changes, rather than simply putting it down to aging.
Thanks, Michelle. And if someone is noticing some of these changes, how is hearing loss actually diagnosed, and what does the process look like, and how would someone get connected with the right support?
That's a great question, Beck, and it's usually a very straightforward process. The first step is usually a hearing test with an audiologist. These tests are simple and painless and non-invasive. They usually involve listening to different tones through headphones, identifying sounds at different volumes and pitches, and sometimes repeating words to check speech clarity. From this, the audiologist can build a really clear picture of someone's hearing. In terms of how to get there, there are options. People can speak with their GP, who can provide a referral, or in many cases, contact an audiology service directly and book a test. If someone is already receiving support, their care team, including nurses or care partners, can also help guide them and connect with them with the services. The main thing is that if you've noticed a change, it's worth having it checked. It's a simple process and it gives really valuable information about what support might help.
And if someone isn't really noticing changes, is a hearing check still something people should be having regularly?
Yes, definitely. Even if someone isn't noticing obvious changes, it's still a good idea to have hearing checked from time to time. Because hearing changes can happen slowly, people often adapt without fully realising there's been a shift. Having a check gives you a bit of a baseline and makes it easier to pick up changes early. As a general guide, having a hearing check every couple of years as we get older is a good idea, or sooner if changes are noticed. It's a simple process and it's really about staying ahead rather than waiting for things to become more difficult.
Thanks, Michelle. So we've talked a bit about hearing now, but I want to shift us across to vision. Michelle, could you talk us through some of the early signs of vision changes that people don't always recognize straight away?
Of course, similar to hearing, changes in vision also tend to happen slowly over time, so they can sometimes be easy to miss in the early stages. Some of the early signs people may notice include needing more light to read, blurry or cloudy vision, difficulty seeing clearly at night, trouble judging depth, like curbs or steps, or needing to hold things further away to see clearly. Sometimes people also notice they feel less confident moving around, particularly in unfamiliar environments. If we look at what's happening in the eye, there are a few important parts involved. The lens helps focus light so we can clearly see, and the retina, particularly an area called the macula, helps process what we're seeing. As we age, these parts can change. The lens can become less flexible or more cloudy, and the retina can become less efficient at processing images. There are a few common conditions we see more often as people get older. These include cataracts, macular degeneration, glaucoma, and general age-related vision changes. Cataracts. This often occurs when the lens of the eye becomes cloudy over time, affecting clarity. People often describe this as blurred or hazy vision, difficulty seeing clearly in bright light or glare, and colours looking a little dull. The good thing is that cataracts are very common and can often be treated with a relatively straightforward procedure if needed. Macular degeneration. This often affects central vision, the part used for things like reading, recognising faces, or watching TV. People might notice blurred or distorted central vision, straight lines appearing wavy, difficulty recognising faces. Peripheral or side vision is usually still there. While we can't always reverse this condition, there is a lot that can be done to manage and support vision. Depending on the type and stage, this might include regular monitoring with an eye specialist. In some cases, treatment such as injections to help slow progression, and nutritional support or supplements if needed. There are also many practical strategies that can help day to day, such as magnifiers, larger print, improved lighting, or high contrast materials. And I think our OT will explore some of these practical supports a little further on. Glaucoma. Glaucoma is a condition where pressure builds up in the eye and affects the optic nerve, which sends visual information to the brain. What makes glaucoma tricky is that it often has no obvious symptoms early on. Over time, it can affect side vision, which is why regular eye checks are so important. While it can be reversed, it can usually be managed, while it can't be reversed, it can usually be managed very well, often with eye drops or other treatments to control the pressure. And when it's picked up early, people can often continue maintaining their vision and independence. General age-related vision changes. There are also more general changes many people will be familiar with, such as needing reading glasses or finding it harder to focus on close objects. Again, many of those changes develop gradually, which is why regular eye checks are so important.
Thank you so much for that, Michelle. And I think what's really important in all of this is recognizing that vision changes don't just affect eyesight on their own. They can start to impact lots of everyday activities over time. Things like reading, moving around confidently, recognizing faces, like you mentioned, managing medications, and even things like driving, because vision plays such a big role in how we safely navigate the world around us. And I suppose that's why regular eye checks become so important as we get older, not just for health itself, but for maintaining confidence, safety, and independence in everyday life. Michelle, when it comes to driving specifically, how does that process typically work as we get older?
Absolutely. Look, I think it's important to say that having changes in vision doesn't automatically mean someone can't continue driving. But because vision plays such a big role in things like depth perception, reaction time, reading signs, and seeing hazards clearly, there are regular checks in place as we get older to help make sure people can continue driving safely and confidently. In New South Wales, there are some age-based requirements. From the age of 75, drivers are required to have a medical assessment each year to renew their licence. This is usually completed by a GP and includes a general health check, which can also look at things like vision. From the age of 85, people can either continue with a full licence, which involves an annual medical assessment and a practical driving test, or they can move to a more modified licence, which doesn't require a driving test, but may include conditions such as daylight driving or local area driving. As part of these assessments, a GP may discuss changes in vision and, if needed, refer someone to an optometrist or specialist for further assessment. And really, the aim of all of this is to help people continue driving safely and confidently for as long as possible, both for themselves and others on the road.
I think driving assessments are actually a really good example of how important vision is in everyday life more broadly. And for anyone who may need a little extra support, whether that's transport to appointments, help getting out and about, or support attending community activities, we'll hear a little later from Sophie, our care partner, about what that support can look like in practice. But even outside of driving, regular eye checks are incredibly important as we get older, whether you're still driving or not. Because many vision changes happen slowly over time, people often adapt without fully realizing how much things may have changed. So, Michelle, from a nursing perspective, how often should people genuinely be having their eyes checked, and what does that process usually look like?
Regular eye checks are really important, even if you feel your vision is fine. Again, many of these changes happen slowly, and early detection can make a really big difference. As a general guide, it's recommended to have your eyes checked every couple of years as you get older, even if you're not noticing obvious changes. Your optometrist may recommend more frequent checks, and depending on your individual situation, particularly if there are existing eye conditions there. In terms of access, it's very straightforward. You can usually book directly with an optometrist without needing a GP referral. Many optometry services also offer comprehensive eye checks, which may be covered depending on eligibility. One practical thing that's helpful to know is that during some eye tests, drops may be used to dilate the pupils. This allows the optometrist to get a really clear view of the back of the eye. Afterwards, vision can sometimes be blurry, and people may be more sensitive to light for a few hours afterwards. So it's usually recommended not to drive after those appointments. Planning ahead for transport can be really helpful, and again, that's something supports can sometimes assist with if needed.
Thanks, Michelle. That's really helpful. And I think that's such a good practical tip about planning ahead for appointments. Thank you again so much, Michelle, for all of that. I think you've really highlighted just how common these changes in hearing and vision can be as we get older, and also how important early checks and regular monitoring can be. So we've talked a lot about recognizing changes and understanding what happens physically as we age, But once someone begins noticing some of these changes, there are also lots of practical things that can help day to day. And that probably brings us nicely across to our occupational therapist. Joy, when you're supporting someone experiencing hearing changes, what sorts of things are you looking at from an occupational therapy perspective? Sorry, Joy, I think you're muted.
Sorry.
Lovely, thank you.
Thanks, Beck. Occupational therapy is really about helping people continue living safely, independently, and confidently in everyday life. When hearing changes begin, we often notice smaller day-to-day impacts first. Things like conversations becoming more tiring, difficulty hearing in busy environments, and struggling to follow discussions clearly or feeling less confident socially. Our role is to understand what's becoming more difficult, what matters most to the person, and what practical supports or changes may help. So when we visit someone at home, we're looking both at the person and at the environment around them. For hearing, that may include how communication is working at home, whether background noise is affecting conversations, whether alarms, phones, or doorbells are being heard clearly, and whether hearing changes are affecting confidence or social connection. We also talk through situations people are finding frustrating or exhausting. For some people, it's struggling to hear when the television is on. For others, it's avoiding cafes or family gatherings because busy environments feel overwhelming. Often, simple strategies can make really meaningful differences, and that might include reducing the background noise, improving lighting so facial expressions are easier to see, sitting closer during conversations, or choosing quieter environments socially. We also talk through communication strategies with both clients and families, including facing the person when speaking clearly and naturally, allowing a little extra time, and checking understanding. Often these small adjustments can really reduce frustration and make conversations feel more comfortable and enjoyable again.
And I know those challenges can sometimes become even more noticeable in busy social environments or out in the community. Joy, what are some examples of supports that can help people experiencing hearing changes?
Yes, often assistive technology for hearing is much simpler and more practical than people expect. These supports are really designed to help people stay connected and communicate more comfortably and feel more confident day to day. Some examples include amplified telephones, which make voices louder and clearer and often include large buttons, adjustable volume, and brighter screens. Some devices can also stream television sound directly into hearing aids or headphones, making programs much clearer to follow. Captioning on television, tablets, and phones can also help people follow conversations more easily, particularly in programs where background noise or fast-paced dialogue. There are also visual alert systems available for things like doorbells, smoke alarms, or phone calls using flashing lights or vibrating alerts rather than relying on sound. Personal listening devices can also help in noisier settings by making the speaker's voice clearer and reducing the background noise. And often it's not about needing lots of equipment. Sometimes one small adjustment or device can make a really meaningful difference to confidence and connection.
And I think sometimes people notice these challenges even more when they're out and about socially or in those busier environments. Places like cafes, shopping centres, family gatherings, or community activities can become much more tiring when there's a lot of background noise happening all at once. So, Joy, what are some practical ways people can support themselves in those sorts of situations?
Yes, hearing in the community, busy environments like cafes, shopping centres and restaurants, family gatherings can become much more tiring when there's lots of background noise, and people often describe being able to hear sound but struggle to separate the conversation they're trying to listen to. Over time, that can affect confidence and lead people to avoid certain situations because listening becomes exhausting. So we often talk through practical strategies that can help these environments feel easier and more enjoyable. That might include choosing a quieter venue, catching up during less busy times, or sitting somewhere with less background noise. Positioning yourself so you can clearly see the speaker, or taking breaks when noisy environments become too overwhelming. Some people find technology useful in the community. Many smartphones now have captioning or speech-to-text features that display conversations as text in real time, which can help during appointments or in busy environments. There are also devices that can help make voices clearer and reduce background noise. And sometimes it's simply about planning ahead and reducing listening fatigue where possible. Because the goal isn't to stop doing the things people enjoy, it's about helping people continue feeling connected and confident, participating in everyday life and community activities.
Thanks, Joy. And I think that really highlights how closely hearing is connected, not just to communication, but also confidence, connection, and well-being. I might move us across now to vision. So, Joy, when someone is experiencing changes in their vision, what are some of the things you're looking at from an occupational therapy perspective during a home or environment assessment?
Yes, when we're supporting someone experiencing changes in vision, we're looking at how these changes are affecting safety, confidence, and everyday activities. Often people first notice things like difficulty reading labels or instructions, needing more light, trouble seeing steps or uneven surfaces clearly, increased glare, or feeling less confident in unfamiliar places. So during a home assessment, we look at both the person and their environment. That may include lighting throughout the home, trip hazards or clutter, contrast between surfaces or steps, how safely someone is moving around, and whether vision changes are affecting tasks like cooking, medications, showering, or getting out into the community. Often vision changes can begin affecting confidence long before someone realises how much they've adapted.
And are there simple adjustments people can make at home that can help with some of these challenges?
Definitely. A lot of what we focus on is making the home safer and easier to navigate and less visually demanding. Lighting is a really big one. As vision changes, people often need more light, particularly in areas like hallways, bathrooms, kitchens, stairs, or when reading. Simple changes like brighter globes, additional lamps, sensor lighting, or improved lighting near walkways can make everyday tasks much easier and safer. We also look at trip hazards and how easy the house is to move around safely. This might include reducing clutter, removing loose mats or cords, rearranging furniture for clearer pathways, or making frequently used items easier to reach. Contrast can also make a big difference. We might recommend contrasting colours on stairs or step edges, plates or cutting boards that contrast with the food, or darker switches, handles or rails against lighter walls. We also encourage keeping commonly used items in consistent places around the home. There are also lots of practical tools that can help, including large print labels, easy to read clocks or calendars, large button remotes, or brighter reading lights. Glare can also have a big impact. So small adjustments like blinds or curtains or changing lighting angles can definitely help reduce strain. We may also recommend safety modifications such as handrails, non-slip flooring, improved lighting near entrance or stairs, or clearer visibility around pathways. And often it's these smaller practical supports together with help people feel much safer and more confident at home.
And similar to hearing, I imagine there are also practical devices or equipment that can help support people with vision changes as well.
Yes. And again, assistive technology for vision is often much simpler and more practical than people expect. It's really about making everyday tasks easier, safer, and less frustrating, and helping people continue doing things as independently as possible. That might include magnifiers for reading medication labels, recipes, bills, newspapers, or instructions around the home. There are also larger print clocks, calendars, telephones, books, and remote controls available that can make everyday tasks easier when small print becomes difficult to see. We also sometimes recommend tactile or high contrast supports around the home, such as raised stickers or bump dots on appliances. Large clear labels and high contrast kitchen tools or textured markers to help identify settings more easily. And often these are very small, low-cost adjustments, but they can make a really meaningful difference to confidence and independence. Many smartphones and tablets have also excellent accessibility features built in. For example, text size can be enlarged. Voice commands can be used. Screens can read messages or emails aloud. The phone camera can magnify text, and colours or contrasts can be adjusted. Some apps can even use the phone camera to help identify objects or read text aloud. For example, someone might use their phone to read a food label or menu, check medication instructions, identify everyday items around the home, or even help recognising people in photos. There are also devices and apps available that can read text aloud, including talking clocks, reading pens, or apps that can scan printed text. And while technology won't replace vision, these sorts of tools can provide that extra bit of confidence and support in everyday life.
Wow, it really is amazing how far technology has come, isn't it? And I imagine many of these supports can make everyday life feel much easier and more manageable, because often it's not just tasks at home that become more challenging with vision changes. Sometimes people also begin noticing changes when they're out in the community as well. Things like shopping centres, unfamiliar places, glare, uneven surfaces, or busy environments can feel a little more difficult to navigate confidently. Joy, is that something you commonly see?
It is. Sometimes people begin feeling less confident in unfamiliar environments, such as shopping centres, uneven footpaths, or places with poor lighting. Vision plays a really important role in helping us judge depth and notice hazards and move around safely. So when vision changes, people may worry about missing a step or a curb, tripping on uneven ground and falling, or becoming disoriented in unfamiliar places. Things like glare, stairs, crowded environments, or difficulty reading signs can make outings feel much more stressful or tiring. Over time, that can affect confidence and lead people to avoid certain places or activities. So again, we often talk through practical strategies that can help people continue getting out and about safely and confidently. That might include allowing extra time, choosing familiar places or routes, planning outings around lighting conditions, wearing sunglasses or glare-reducing lenses, using mobility aids or supports where appropriate, or making sure environments are easier to navigate safely. And again, the goal isn't to stop people doing the things they enjoy. It's about helping people continue feeling safe, connected, and confident in everyday life and their community.
Thank you so much, Joy. I think that's really come through today, is that there are so many practical supports available for people experiencing hearing and vision changes. We've talked a lot today about recognising changes, practical strategies now, and equipment supports, but another really important part of this is the day-to-day support people may receive in everyday life. So I might bring in our care partner, Sophie, now. Sophie, can you talk a little about the role of a care partner and what support can look like day to day for someone living with hearing or vision changes?
For sure, thanks, Beck. And I think one of the most important things to understand is that a care partner's role is really about working alongside that client to help coordinate supports and make everyday life feel safer, easier, and more manageable as their needs change over time. A big part of our role is getting to know that person, what's important to them, what they enjoy, and what they want to continue doing, and what they might need a little extra support to remain safe, independent, and connected to their community. We also help people navigate services and supports and coordinate their care, linking with other health professionals where needed, and to make sure supports continue meeting their needs as things change over time. Because hearing and vision changes affect everyone very differently. For one person, it might be feeling less confident getting to their appointments or shopping independently. For someone else, it might be they may find it difficult managing communication, reading instructions, getting out socially, or feeling more isolated because activities they once enjoyed and loved have become harder to complete. So a big part of our role is about listening, recognizing those changes early, and tailoring supports around the person and their goals.
So, Sophie, what are some examples of the ways support might be tailored day to day for someone experiencing hearing or vision changes?
A lot comes down to understanding that person well and making sure the supports around them are tailored to a way that helps them feel comfortable, confident, and understood. And that's just not about the services themselves. It's also about how we communicate and how our staff approach support, and making sure people are receiving assistance in a way that works best for them and only them. For example, if someone is experiencing hearing changes, if someone is experiencing hearing changes, we might make sure staff understand to face the client clearly when speaking, reduce background noise where possible, and allow extra time so communication doesn't feel rushed, or help support the use of hearing devices or communication tools. For someone experiencing vision changes, supports may include providing information in larger print or easier to read formats, helping identify items, labels, or instructions when needed, supporting safer navigation around the home or community, or helping make environments feel safer and easier and more comfortable to manage. And often it's also about tailoring their routines or outings in ways that help people continue participating confidently in their everyday life. That might mean allowing extra time when attending appointments or shopping, supporting someone in unfamiliar environments, helping plan outings in ways that feel more manageable, or simply having someone alongside them for reassurance and confidence. And often those thoughtful adjustments and supports help people continue feeling connected to their community and are able to keep doing the things they love and enjoy.
Thanks, Sophie. And I imagine a really important part of this is helping people continue feeling independent and included rather than limited by these changes.
Definitely. And I think that's something we feel really strongly about here. The goal is to never take over or to stop the person doing things they enjoy. It's about supporting the individual to continue living the life they want to live in the safest and the most confident way possible. And a really important part of that is recognizing the support shouldn't feel one size fits all. We always try to tailor supports around the individual person, their preferences, their routines, and what helps them feel most comfortable and confident day to day. For example, some people may prefer support attending appointments or shopping at certain times of the day. Some others may need communication adjustment to better support hearing changes. Some may benefit from more social support or accompanied outings. And others may need support with reading information, navigating the community, or managing things safely at home. Because independence looks different to everyone. For one person, it may be helping to continue to attend weekly social groups, church, or community activities. For someone else, it may be feeling confident enough to continue shopping, attending appointments, preparing meals, or staying socially connected with family and friends. And often those sorts of tailored supports help people continue participating in everyday life and community activities rather than gradually withdrawing from them. Sometimes the support may involve practical things like transport assistance, accompanied outings, communication support, orientation support, or mobility supports to help people continue participating in the community safely and confidently. And for some people experiencing more significant vision impairment, supports like guide dogs or orientation and mobility services can also play an important role in supporting confidence, safety, and independence. While those supports are generally provided through specialist organisations, part of our role is helping people understand what services, supports, or funding pathways may be available to them and how those supports can work alongside the care they're already receiving in their own home.
And I think sometimes people may not realise there can also be funding or support pathways available for some of these services or equipment as well.
Correct. And part of our role as care partners is helping people understand what supports or funding options may be available to them and helping coordinate those supports where appropriate. Under the new Support at Home program, there is also the Assistive Technology and Home Modifications, or ATHM scheme, which provides separate funding for eligible equipment and home modifications that help people remain safe and independent in their own home. What's really helpful about this scheme is that the funding sits separately from someone's ongoing Support at Home services budget. So rather than needing to use their regular day-to-day care funding for assistive technology, safety supports, communication devices, or home modifications, there may be separate funding pathways available for eligible supports so that they can make a really big difference, because it may help people access the equipment, technology, or supports they need sooner, while still using their ongoing Support at Home funding for the services helping them day to day. Depending on someone's individual needs or assessment outcomes, funding may be available for things like assistive technology or communication supports, mobility aids such as walking frames or wheelchairs, home safety equipment, handrails or ramps, bathroom modifications, or equipment that helps people manage everyday activities more safely and independently at home. For people experiencing hearing and vision changes, this may also include supports that improve communication, safety, mobility, confidence, or access within the home and community. And importantly, people can still access assessment and funding pathways for assistive technology or home modifications, even if they're waiting on other ongoing Support at Home services. For people receiving Support at Home programs like CHSP or Support at Home, the pathways and funding arrangements may look a little different depending on the individual's situations or needs. For some people living with significant vision impairment, supports like guide dogs or orientation and mobility services can also play an important role in helping people feel safe and confident navigating the community. While those supports are generally provided through specialist organisations, part of our role may be helping clients understand what services, assessments, supports, or funding pathways may be available depending on their situation. And often people don't realise what supports, equipment, or services may be available until they start having these conversations. So a big part of our role is helping guide people through that process, linking in the right professionals when needed, and making sure supports are tailored around what matters to the person and how they want to continue living their day-to-day life.
Thanks, Sophie. And I imagine when the right supports are in place, it can really make a difference, not only to safety, but also to confidence and quality of life.
Definitely. And often the biggest difference we see is people feeling more confident and connected again within their community. Sometimes when hearing or vision changes progresses, people can gradually start withdrawing from activities or situations that once felt normal and enjoyable. But with the right supports around them, whether that's equipment, therapy, service adjustments, social support, transport, or simply having someone alongside them, people can often continue doing the things that are meaningful to them for much longer. And I think that's what this is really all about.
And Sophie, I know you probably see this firsthand all the time. Do you have an example or story you might be able to share with us today about how the right supports can make a difference for someone experiencing hearing or vision changes?
Absolutely. And obviously I'll keep the details general for privacy, but for one client I supported comes to mind straight away. She was an older lady living alone who had been experiencing significant vision loss over time. Before supports were introduced, she had gradually started losing confidence, leaving the house independently. Simple things like shopping, attending appointments, catching up with friends, or navigating unfamiliar environments had started to become really stressful and exhausting for her. She also relied heavily on her guide dog, who played such an important role in helping her feel safe, confident, and independent when navigating the community. While the guide dog itself and specialist trained support were provided through a specialist organisation, part of our role was helping coordinate broader supports around both her needs and the practical responsibilities that came with caring for and maintaining her guide dog as well. For example, we were able to support with things like transport to appointments and community outings, supporting and attending grooming or veterinarian appointments for her guide dog, helping organise routines and services around both the client and her dog, accompanied outings for confidence and safety, and helping coordinate funding pathways and supports that supported her for her independence. Through her care supports, we also organised occupational therapy assessments and recommendations, assistive technology supports, communications and reading supports, and practical home safety changes to make her environment easier and safer for her to navigate. Some of the changes around the home included improving lighting in key areas of her home, adding contrast strips near steps and transitions within her home, reducing trip hazards and cluttered walkways, using tactile markers on appliances like the microwave and the washing machine, and introducing larger print labels and talking devices for important everyday tasks. We also worked closely with her around her routines and her community access, helping plan outings at times she felt most comfortable, supporting her to continue attending social activities she enjoyed, and making sure supports were delivered in ways that helped her feel confident and included rather than restricted. And I think the biggest change wasn't just practical, it was emotional as well. Over time, she became much more confident, getting out and about, reconnecting socially, attending appointments independently with support around her, and continuing to live the way she wanted to live. And I think that really highlights what good support should be about. We don't take away independence, but we support and help people to maintain for as long as possible in a way that feels safe, respectful, and empowering.
Thank you so much, Sophie. That's such a helpful way to bring this to life, and thank you for sharing that lady's lovely story. And I think what really stands out is that it's not about losing independence, it's about having the right support in place to help maintain it. So I might just pause here and open things up for some questions. If you have any questions, if there's been anything that's come out throughout the session, please feel free to pop them in the Q&A section on your screen. You should see a little button that says Q&A. If you click on that, there'll be a space where you can type your question and send it through. So there's a few questions here asking if we can prevent these conditions. I might throw, excuse me, sorry. I might throw over to our RN, Michelle, to talk a little about some prevention strategies and her help answering, is there anything people can do to help prevent hearing or vision decline as they age?
I think this is such a valuable question because while some hearing and vision changes can naturally occur as we get older, there are definitely things people can do to support their hearing and vision overall well-being and independence over time. Some really helpful strategies can include having hearing regularly checked and vision regularly checked, managing chronic health conditions like diabetes and high blood pressure, protecting hearing from excessive noise, exposure where possible, treating hearing or vision changes early rather than waiting, having ear infections, ear pain or blocked ears reviewed by a GP or hearing specialist, having earwax professionally checked and managed if it is affecting hearing, wearing prescribed glasses or hearing devices consistently, staying socially connected and mentally active, and maintaining good nutrition and hydration, and also keeping physically active. We know that hearing and vision changes can sometimes happen gradually, so people often adapt without realising how much things have changed over time. And sometimes something as simple as impacted earwax or untreated ear infection or outdated glasses can significantly affect hearing, communication, confidence, and day-to-day function. So it's really important not to assume changes are just aging and to have concerns checked regularly. Early support can make a really significant difference, not only for communication and confidence, but also for safety, falls prevention, social connection, and maintaining independence at home.
Lovely. Thank you, Michelle, for that answer. We have another really good question here, which is probably a good one for our OT, Joy, to answer. The question is, it is unfortunate that the government-funded hearing aids for pensioners are often battery operated, which can be difficult for people with vision or dexterity issues. Is there any way around this? Joy? Oh, sorry, Joy, you're on mute again.
Thank you. Sorry.
Beautiful.
I'm just
Thank
trying
you.
to improve the background noise.
Thank you.
That's a really important point. Thanks, Beck. And something many older people and families experience and feel understandably frustrated by. A lot of people believe government-funded hearing aids are only battery operated because many of the fully subsidised basic models historically have been. Rechargeable hearing aids have often involved an additional cost, so people are frequently told there is a gap to pay. For people living with arthritis, vision changes, tremors, reduced hand strength or reduced dexterity, changing these tiny hearing aid batteries can become really difficult. Over time, that can affect confidence, independence, and even whether the hearing aids are worn consistently at all. So it's completely understandable that people feel frustrated by that. The good news is that rechargeable options are becoming more common, and depending on the provider and device, there may sometimes be a lower gap or partially subsidised options available. This is always worth speaking openly with the hearing provider about any difficulties managing batteries, because this can help guide more suitable recommendations. It also can help to ask whether there are trial devices available to test first, or whether payment plans are available to make rechargeable options more affordable. There are also some practical supports that can make battery-operated hearing aids easier to manage, including battery handling tools, magnetic battery sticks, and magnifiers, improved lighting, labelled storage containers, or simple routines for changing and storing batteries safely. Sometimes additional support around the person can make a big difference too, whether that's family helping with maintenance or support workers assisting during visits, or an occupational therapist providing practical strategies and equipment recommendations. And I think really importantly, The thing to remember is that if someone is finding hearing aids difficult to manage, they are certainly not alone. These challenges are incredibly common, and often small supports or adjustments can make really meaningful difference to confidence, communication, and staying connected.
Thank you, Joy. Okay, we probably have time for one, one more, and I might go to Sophie for this next one. Sophie, how do you convince your parent that they need to consult a hearing specialist?
This is a very common challenge for families, and often the resistance comes from fear, stigma, frustration, or simply not recognising how much hearing has changed over time. Hearing loss usually happens very gradually, and so many people don't fully realise the impact it's having day to day. Sometimes it also affects how they feel emotionally, because hearing changes can be linked with worries about aging, independence, appointments, technology, or needing hearing aids. Often it helps to focus less on the hearing aid itself and more on the things the person values, like staying connected with family, enjoying conversations, feeling confident socially, or staying safe and independent. Gentle encouragement over time is usually more helpful than one big conversation. Sometimes suggesting just having a hearing check can feel much less confronting than immediately talking about hearing aids. It can also really help to involve a trusted GP or health professional, because people sometimes are more open to hearing advice coming from someone outside of the family. And importantly, it's very common for people to need time to adjust emotionally as well as physically. So approaching the conversation with empathy, patience, and understanding can make a really big difference.
Thanks, Sophie. Okay, just being mindful of time, we might need to wrap up the Q&A there for today. But thank you again for all the wonderful questions that came through. If there were any questions we didn't quite get to during this session, please don't worry. We'll make sure responses are included in the follow-up email after the webinar, along with the recording and the resources. It's been really lovely to see so much engagement and such thoughtful questions throughout the session. Excuse me, and thank you again to all of our fabulous speakers for sharing your knowledge, experience, and such practical advice. I think one of the really important things to remember is that hearing and vision changes are incredibly common as we get older, and support doesn't have to wait until things become difficult or overwhelming. Often it's about recognising changes early, understanding what supports are available, and finding ways to continue doing the things that are important to you. I think what's really stood out throughout today's session is that staying connected and engaged through hearing and vision changes isn't about one single solution. It's about recognising changes early, having the right information and support around you, and making everyday life feel safer, easier, and more manageable. Today, we've talked about common hearing and vision changes as we get older, the importance of regular hearing and eye checks, practical strategies around the home and in the community, assistive technology and equipment supports, ways services can be tailored to support independence, and the different supports and funding pathways that may be available. And when you bring all of those things together, what it really creates is confidence, connection, inclusion, and the ability to continue doing the things that matter most to you. And I think one of the biggest messages to take away today is that you don't have to navigate these changes alone. Whether that's having a conversation with your GP, optometrist, or audiologist, exploring supports or pathways or services available to you, making adjustments around the home, using assistive technology, or simply having someone alongside you to help guide and coordinate support. There are people that can help you understand what options might be available based on your individual needs and goals. And for anyone supporting a loved one, simply starting those conversations early, gently and positively can make such a meaningful difference as well. Because ultimately, this is about much more than hearing or vision alone. It's about helping people stay connected to their community, their independence, their confidence, and the life that they want to continue living. Thank you again so much for joining us today. It's been so lovely to have you here with us. We hope you're leaving today with some practical ideas, helpful information, and reassurance that support is available when you need it. And perhaps most importantly, confidence that hearing or vision changes don't mean you have to stop doing the things that are important to you. We also have a wonderful range of webinars coming up throughout the year covering different topics that support staying safe, well, connected, and independent at home. So if any of those topics are of interest to you, excuse me, we would absolutely love for you to join us again. Following today's session, we'll also send through a recording of today's webinar, helpful resources and links, answers to any remaining questions we didn't quite get to today, and information on how to register for the upcoming webinars. So please keep an eye out for that. Thank you again for spending this time with us today. Take care, stay connected, and we hope to see you again at one of our future sessions.